Joining me today is New Hampshire State Senator Dan Feltes. So Dan, you know, one of the issues, I think, back to the sort of budget, and it also, I think, ties into some big policy discussions that suggestions you had along, deals with Medicaid expansion.
Right.
At the end of this fiscal year, as I recall, am I correct in that? The law will expire. It has to be renewed.
Correct.
2016. Is that a big sticking point in the budget debate?
Well, you've heard a preference from some of my Republican colleagues to have the debate on Medicaid expansion outside of the context of the budget. It's perfectly reasonable to have the debate in the context of the budget, and certainly we had that debate, and Republicans voted against reauthorizing Medicaid expansion when we had that vote previously. So, however it's going to take whatever form it takes, it's very important that we do it, whether it's in the budget or reauthorized early next year, 2016. It's so important that we do it. We're talking over 40,000 Granite Staters, John, who receive health insurance through Medicaid expansion, and reduces the hidden tax on everyone of uncompensated care in our healthcare system. So it's good for businesses, it's good for families, it's good for the Granite State economy as a whole.
Well, the Senate and there's not much history on this, but the Senate and the House sort of initially took different opinions on this. Is it likely the Senate, which is a majority Republican, would find a way to move forward on keeping this in effect, or is it likely that the Senate won't?
We've certainly heard positive public statements from Senator Jeb Bradley and some others, and I think hopefully both the Senate and the House move forward on reauthorizing it, either in the context of the budget or early next year. It's so important that we make sure that over 40,000 hardworking Granite Staters continue to have access to health care, and that we continue to reduce costs in the system. That's helpful for the families, it's helpful for businesses, it's helpful for the state as a whole, and we need to reauthorize Medicaid expansion. It's a big issue, and I'm hopeful that leadership in both the House and the Senate recognize that.
Should the governor, and I hate to put you advising the governor, but I mean, her bargaining chip has got to be the budget. If it's not in the budget, I would think she loses leverage to be able to bargain for this, and I think she's for this.
Well, the governor has certainly been Governor Hassan has been a big advocate of Medicaid expansion, and for many of the reasons that I just articulated. Yeah. It's good for the economy, good for businesses, good for families. Whether it's reauthorized in the budget or early next year, that's the context of some of the conversations that are ongoing. But the most important thing, John, is it gets done. It has to get done.
We're going into an election cycle, so people will be able to see how people vote and if it's a priority or not.
Well, John, I think it's not so much about the next election. It's about who gets left behind in the process. Right. And right now, the right thing to do is reauthorize Medicaid expansion for over 40,000 Granite Staters. That's their access to health care. It helps them. It helps our economy. It's not about the next election. It's about what's the right thing to do, and the right thing to do is reauthorize it.
Well, what's the argument against reauthorizing it?
Well, we've heard arguments from some folks that, at least right now, that they want to study it more. I think much of the data is in that it reduces uncompensated care. Uninsured emergency room visits are down, I believe, 20% or more, based on a report from the New Hampshire Hospital Association.
So that would be things that you think somebody who's been in the state for decades and decades, you think would have broad bipartisan support.
Well, it certainly enjoyed some bipartisan support the last time it was reauthorized, including, as I mentioned, Senator Jeb Bradley and some other folks voted for it. I don't have the full tally in front of me, but in any event, the other arguments that you hear sometimes is, well, the share that the state needs to kick in. How are we going to make sure that the federal government,
Well, that's why I would have thought it would have been in the budget, because New Hampshire's percent goes from 0 to, I don't know what the number is, 5 or something.
Right.
So,
So, I mean, yeah, it's certainly an issue that has a cost associated with it. The question is not necessarily that cost right now. Some folks raise the question of, well, down the road, what will the federal government require states to do? And I think the easy answer to that question is, well, we're not down the road, and right now this is what it is, and so we should reauthorize it.
and with that, we are out of time. So, but we'll have to come back to this at a later date.
Thank you, John.
Hey, thanks so much for being here.
You got it. Take care.
All right.